Look, Minister, I'd just like to ask you for an update in relation to the rapid antigen testing rollout across our universities. I understand that you have been speaking about this for a number of months, as have I and a number of other members, and it's something that I'm eager to see progressing. So if you could give us any details on where we're looking at for September.
Thanks, Deputy Minister.
Pádraig O'Sullivan for raising this matter as he has on a number of occasions, and I want to assure him that I and indeed the whole of government are absolutely committed to a significant increase in on-site attendance in further and higher education sectors in the next academic year. We all know the reasons. They've been well rehearsed and well based in public health evidence as to why we had to remain online this year, but we're also aware we can't repeat that. It's not a sustainable situation to be in from an educational point of view, but even more importantly from a well-being point of view. We need particularly our young people back in college. It's been a hell of a long time since a first-year student has actually had on-site access to education, considering they left school sixth year in March 2020. So my department has established a working group, and it includes students, it includes the unions, it includes the representative bodies, it also includes NGOs and educational institutions to prepare a plan for the new academic year. It's due to meet again tomorrow to discuss the issue, and I will publish a plan for the new semester in the month of June next month. Rapid testing will form a part of that plan, absolutely, but it is only one part of a package of measures that could support greater on-site activity. There will be a rapid testing study, or pilots if you want to call them that, rolled out across 4 universities this month: Trinity, UCC, UCD and NUI Galway. And this will help us learn more about the potential role rapid antigen testing can play in our sector, but perhaps also more broadly we can share those lessons with other sectors as well. My department is also participating in a HSE antigen testing pilot working group, which is working with the HSE on the piloting of antigen testing in the education sector, including at 3rd level. So really excited about antigen testing, really eager to get the rapid testing pilots underway. They are starting this month. There is a commitment to funding of over €1 million from my department, but I want to be clear. Rapid antigen testing is only one of the tools at our disposal, and the return to campus this autumn is not dependent on such testing. The adoption of detailed procedures and guidelines encompassing public health advice has played a central role in ensuring that essential and time-critical on-site activity could take place this year, and we now want to expand that advice and the benefits of the vaccine programme to get our students and staff back to campus in September and October.
Look, that's great to see that there's progress being made, and that hopefully it will ensure that we have a return, an on-site return in September. So look, that's welcome, and I welcome the fact that that rapid antigen testing will just be part of that, as you said. That said, I take what you said, because you've been a proponent of this for a long time, and I know that, and this isn't a criticism of you specifically, but I do believe as a government we can do an awful lot more. And the dogs on the street know the pros and cons of rapid antigen testing. It's not as accurate as PCR, we understand that. But at the same time, if you look at other developed countries, whether it's the UK or across Europe, there are hundreds of thousands of people receiving rapid testing every week. It's identifying hundreds of thousands of cases across the continent in terms of people in their most infectious state. And given that come next September, the majority of adults here will be vaccinated, please God, in time for universities to return. If there is any delay in the vaccination rollout, it is most likely to affect those 3rd level students, being that they're from younger cohorts. So I suppose it's imperative that we roll that rapid antigen testing out as quickly as possible, and I believe that while a pilot is welcome, I believe that we need to be looking at it at all 3rd level institutions. Thank you.
Deputy.
Yeah, I am a major proponent of at least trying rapid testing, and I suppose it'd be a bit weird if the Minister for Research and Science wasn't, considering the Chief Scientific Advisor to our country and to myself and to Science Foundation Ireland is so clear in relation to this. I simply don't think we have anything to lose by trying this, particularly as a surveillance method. So I very much take the points that our medical experts and doctors make. This is not a PCR test, as you say. No one's suggesting that it is, but it's another tool in monitoring and the surveillance of a virus that can rapidly change and evolve, and we've seen benefits in other jurisdictions. So our intention is to roll out these pilots this month. That work is underway, the funding is in place, and if there's benefit, we'll absolutely expand it, and if there isn't, sure, what loss? That's the way we think we have to approach science and research. You try things, you learn from them, and if they work, you expand them. But we're going to get the students back to college on a combination of, yes, the potential of rapid testing, yes, the vaccination programme, but also the application of good public health guidance and any resources that are needed to go alongside that. They're really the three legs of the stool, but we are getting students and staff back to campus in the new academic year. It is essential, and the Taoiseach, I think, couldn't have been clearer when he addressed the nation at the end of May in relation to this. Sorry, end of April.
Okay.